What happens if a man goes without sleep for a year? Is it possible? It is not possible for a human being to go without sleep for a year. The longest recorded time without sleep is 11 days, and this was accomplished through a series of medical interventions and strict monitoring. Sleep is essential for the proper functioning of the body and mind. During sleep, the body carries out essential restorative processes, including the consolidation of memories, repair and rejuvenation of the body's cells, and the release of hormones that regulate various bodily functions. If a person were to attempt to go without sleep for an extended period of time, they would experience a range of physical and psychological symptoms. In the short term, they would experience fatigue, irritability, and difficulty concentrating. They may also experience physical symptoms such as headaches, muscle aches, and a weakened immune system, making them more susceptible to illness. As time goes on, the person would experience more severe symptoms, such as hallucinations, delusions, and psychosis. They may also experience mood swings, depression, and anxiety. In extreme cases, they may experience seizures, heart failure, or other life-threatening complications. It's important to note that sleep deprivation can be a serious issue, and it's important to prioritize good sleep hygiene and seek medical attention if experiencing persistent insomnia or sleep-related problems. The recommended amount of sleep for adults is 7 to 9 hours per night, and it's important to prioritize healthy sleep habits to promote overall health and well-being. Sleep is an essential physiological process that is crucial for the proper functioning of the human body and mind. During sleep, the body undergoes a range of important processes, including the repair and rejuvenation of cells and tissues, the consolidation of memories and learning, and the regulation of various hormonal and metabolic functions. When a person is deprived of sleep, their body and mind begin to experience a range of negative effects. In the short term, sleep deprivation can lead to physical and cognitive symptoms such as fatigue, irritability, difficulty concentrating, headaches, and muscle aches. Over time, sleep deprivation can lead to more severe symptoms, such as hallucinations, delusions, and psychosis. Chronic sleep deprivation has also been linked to a range of health problems, including obesity, diabetes, cardiovascular disease, and mental health disorders. While it is not possible for a human being to go without sleep for a year, there have been documented cases of extreme sleep deprivation that have led to significant physical and mental health issues. For example, in one case, a man stayed awake for 11 days in a controlled laboratory environment and experienced hallucinations, paranoia, and memory loss. Overall, it is important to prioritize good sleep hygiene and seek medical attention if experiencing persistent insomnia or sleep-related problems. This includes establishing a regular sleep schedule, avoiding caffeine and electronics before bed, creating a comfortable sleep environment, and managing stress and anxiety. By prioritizing healthy sleep habits, we can promote overall health and well-being and avoid the negative effects of sleep deprivation. Sleep is a complex process that involves a series of physiological and neurological changes throughout the body and brain. The process of sleep is divided into two main types: non-rapid eye movement, NREM, sleep, and rapid eye movement, REM, sleep. During NREM sleep, the body undergoes important physiological processes such as the repair and restoration of tissues and the regulation of hormonal and metabolic functions. NREM sleep is divided into 3 stages, with each stage characterized by different levels of brain activity and physiological changes. REM sleep, on the other hand, is characterized by increased brain activity and rapid eye movements. During this phase of sleep, the brain consolidates memories and learning and regulates emotional and cognitive functions. The amount of sleep needed by an individual can vary based on a range of factors, including age, lifestyle, and overall health. The recommended amount of sleep for adults is 7 to 9 hours per night, although some individuals may require more or less depending on their individual needs. Chronic sleep deprivation, or a long-term lack of sleep, has been linked to a range of negative health outcomes, including obesity, diabetes, cardiovascular disease, and mental health disorders. It is important to prioritize good sleep hygiene and seek medical attention if experiencing persistent insomnia or sleep-related problems to promote overall health and well-being. Sleep is not just a passive state of rest. It is an active and complex process that involves a series of physiological and neurological changes throughout the body and brain. These changes allow the body and brain to rest, rejuvenate, and restore themselves for the next day. During sleep, the body undergoes a range of essential processes, including the repair and rejuvenation of cells and tissues, the regulation of hormonal and metabolic functions, and the consolidation of memories and learning. These processes are essential for maintaining good health, and a lack of sleep can have serious negative consequences for both physical and mental health. Sleep is also closely linked to a range of other health outcomes, including immune function, cardiovascular health, and mental health. Sleep deprivation can impair immune function, making individuals more susceptible to infections and illnesses. It can also increase the risk of cardiovascular disease by disrupting the body's regulation of blood pressure, heart rate, and other important functions. Sleep deprivation can also have significant negative effects on mental health. It has been linked to an increased risk of depression, anxiety, and other mood disorders. Chronic sleep deprivation can also impair cognitive function, including memory, attention, and decision-making. Overall, sleep is an essential aspect of health and well-being, and it is important to prioritize good sleep hygiene to promote overall health and well-being. This includes establishing a regular sleep schedule, avoiding caffeine and electronics before bed, creating a comfortable sleep environment, and managing stress and anxiety. By prioritizing healthy sleep habits, we can promote overall health and well-being and avoid the negative effects of sleep deprivation.